most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
We
therapist.
are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So, with that in mind, today we're going to stop neck, back, and shoulder pain fast using your belt. It's a self-treatment that works, and we have been using these for years.
Oh,
haven't we, Brad?
absolutely. Well, one thing about therapists, if we can come up with an exercise, very easy, very inexpensive, and you can do at home, we'll do it. And it's
Yeah,
kind of our trademark.
You don't have to purchase anything
That's
if you have
right.
a belt already. If you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. What are we giving away, Mike?
Mike, what is it? Caught him off
I
guard.
don't know. So we go to Bob and Brad, go to the giveaway section. We'll tell you what we're giving away there. Or go to Facebook. It'll be pinned at the top of the page, the contest. The Pete's Choice.
Pete's Choice.
Pads,
yes.
Yeah. Go to Twitter, Instagram, and TikTok if you want a 60-second version of our program.
That's right. Okay, Bob. You know, one of the reasons I did this video is because I've got a neck issue right now,
Yeah.
so I start using
You're moving better, though.
Yeah, it's feeling about 50% better.
Yeah.
And it's like, man, and I start thinking all the things we do with belts between our shoulders, back, and neck. It's like we got a
video for
we got to
this.
accumulate this into a beautiful video and spread the word
There we go.
of the good belt. So anyways, we'll start with the neck.
Yeah, go from head down further,
Exactly.
right?
So one thing now, this is my belt. This happens to be one we use at the studio. I think it was yours.
Here's my belt, yeah.
But most people have these types of belts. I'm going to show you. The width of the belt can make a difference, and it's dependent on the individual and the symptoms that you're having. I'm finding this belt right here is really good for the neck, and that's what we're going to show first.
Because it grips.
Yeah, it's not slippery. It's not too wide for my neck. Sometimes a skinnier belt works good for the neck, so you can go to a specific level. Bob, should I demonstrate? I'm going to take this off, so you'll have to talk through it. Very, very common and very successful over the years. We've had great success, wouldn't you say, Bob?
Yeah, we have. I'd say, quite often we recommend using a towel, but the belt is a lot more specific and it grips a lot better. So it really works well. Brad's going to show you extension, right, Brad?
Right.
So he's going to go back. Yeah, he's got pain in his upper neck, so he's going to try extension. So, and do you angle it, Brad, or not?
Yeah, well, I can show both options.
Yeah. You can go straight out, or you can angle it a little bit because the joints are angled like this at like a 45, right? So if he pulls it up like that, he's actually, and what he's doing is he's trying to bring the neck back as far as possible without increasing his pain. It feels good. Yep, and if it feels good, that's a really good sign. That's what we like to hear. Now you can also try different levels. You can go down further. Yep, you might find that yours is, and you want to find the one that feels the best. The one that feels the best is the one that's going to work best for you. So, are you going to do rotations too, Brad, or not?
Well, Bob, I just want to, like in my case,
I'll interpret it for him. In his case,
left turning hurts.
he has trouble turning to the left, and I saw that right away today. It was better, though, because you came and you looked at me, and you turned your head. So,
if I do this, I'm going to work my rotation. There is no pain.
So he gets back, and he actually rotates the head when he's extended. It's like we tell people just to wiggle their nose back and forth. And obviously you have to move your neck to do so. You're not from Bewitched. Yeah, always zero pain. You might feel a little crunching when you go back like that. I often have patients say that. But look at him turn there. Yep.
That's clearly better.
Yep, it's better. And you're going to do rotation, Brad? Yeah. So this gets a little tricky on the rotation because you put the belt in place, and then you actually switch your hands. So see how he switched hands? And now he can go ahead and don't lean back, Brad, because your mic is right behind you. Okay. And then he goes across the face, across the jaw. And again, can angle up a little bit. So he's at the angle of the joints and he pulls across. Now this arm stays stationary. He doesn't go along with it. Yeah, yeah. Sometimes people hook behind the chair, but if he doesn't, he might go like, you want to show it wrong, Brad? Yeah, like that. That's what we don't want. And, don't choke yourself. But, and again, always pain free. These should feel good. This should feel like the right thing to do.
And it does. This feels better.
Yeah.
Well,
And Brad's doing both
little
sides
bit
there.
better, so I'm not going to go too aggressive.
Yeah, he says he's having a little pain to the left, so he's not going to be real aggressive. Why don't you put your mic back on, Brad, and we can talk about the shoulder next.
Okay, yeah.
So with the shoulder, one motion that we're trying to obtain is internal rotation and maybe even a little bit going up the back too. Because quite often when you have a shoulder problem, if you compare the two, like let's say I'm having trouble on this side, often I can go way up on this side, but this side might only go this far. So we need to regain that back.
Yep.
And so the belt is a great way to do this because it's slippery. This is where you want a slippery belt.
You don't want to use the belt for the neck. You want
Right.
a nice leather or a smooth, shiny belt. And it works good to have one of these
A little loop.
belt loops so you can slip it through there and it just goes down. So if this is actually this shoulder was having problems, it's getting much better now. So
Brad, you're a mess.
yeah, I know. This is the hardest thing is to get this lined up
Sure.
like this.
There you go.
There. So
Now look how that slides.
yeah. Now that smooth belt makes that friction much less, which helps a lot. I had a patient, she was scheduled for surgery. She was about 55 at the time, and the doctor didn't have surgery or physical therapy, and she said, I want therapy before I do surgery, just in case. 4 treatments, this is her primary exercise, surgery canceled.
Yeah.
It was-
There's a few other stretches we have people do, but
Yeah.
this is one of the main ones that we do, eventually do.
and again, must be
Pain free.
yeah, a little stretch discomfort,
Yeah.
but no
You
sharp
can
pain.
bump into the pain,
Yeah.
as we like to say, but
And-
okay.
All of these we're going to do maybe 5 to 10 reps more if it feels better. You have to be cautious, particularly the first time you try it, because you have to wait for a few hours and see how it feels after the stretch. Okay, extension and standing.
Sure.
I'm going to use the belt that sticks a little
Okay.
bit. So, you want to talk about it,
Well,
Bob?
you can actually go lower,
Yep.
or you can also get the mid back with this one.
Right.
And when you go with the mid back, yeah, you're gonna probably go ahead and pull straight up almost.
Yep.
And it really is a good one for working that mid back.
I will do this for maintenance, and I'll just start up here. And a lot of times I'll get my back to crack.
Kinda
Of course,
go
that's
all the
always-
way down.
Yep. And then I'll work a level at a time.
Sure.
Oh, my
And this
goodness.
again, where the belt works really well because it grips pretty good.
Yes, exactly, Bob.
And even this one's all right too.
Yep.
I mean, it really works pretty well.
Now,
out
if
there
you got
at all.
spondylolisthesis or lumbar stenosis,
You won't want to do
you're
that.
probably not going to. When I get down here, I'm very gentle because with my
Yeah.
spondy, it irritates a little
But
bit.
you're able to do the mid back.
Yes.
Okay.
Yep, up there. And we're almost done, Bob.
Yeah.
We got down. Now we're going to do for low back specifically.
Now I don't know if I can do this, Brad, because I have a belt on already, but I'm going to put it in the loop.
And there's a reason. We'll show
Yeah.
you in just a little bit.
'Cause-
That belt's going to be a little short.
Yeah,
I
it's
think,
going to be a
Bob.
little short, but it'll be work. So what happens is that belt slides up, and I want it down in the low back to provide
Right here.
pressure. This is for somebody who's been doing extensions like this, and they get stuck. They only go so far, and then they can, they start
Yeah.
lifting off the bed. So we want to give a little counter pressure, and so we use the belt.
Now, as a therapist, I'll hold my hand here to
Right.
support, but
Right.
obviously you can't do that at home. So, we add the belt. Now, I'm not going to put it through your loop.
Yeah. Now the belt, this is one where you might use a sheet instead. You know what I mean?
Yep.
Brad?
Or a longer
A
belt.
longer belt. Yeah.
I don't know if they can see it, Mike, because your shirt and your arms
Oh.
kind of in the way. But, and again, you want to get this at the right level. That's why if you want it
Right.
low, you put it through the belt loop to hold the belt from sliding
Yeah.
up.
Because quite often with a sheet or a towel, it just slides right up there, and you don't have it in the area that you want it to have.
And again, with this one, you're only going to do this if it feels good,
Yes.
particularly after you get done.
Yes.
You know, it's like, oh, if you have sciatica and the leg pain's getting better, then you do it. If it's getting worse,
Yeah, whoever came up with that phrase, no pain, no gain, we ought to shoot them, because in therapy, it's no pain, no pain. We don't want no pain.
yeah, there's
So-
a few exceptions, but not
Few
with these.
exceptions.
Yeah, that
Yeah,
total
maybe.
knee
Total knee
replacement.
replacement. I was going to say, we're going to make people cry. So, all right.
All right, wow.
Remember,
So,
we can fix just about anything.
Bob, we did that in record time. I thought we were going to go over
I know. I
12
thought you were
minutes.
going to go over
Yeah,
it.
so these people we got a little babble time here. You know, the people that,
By the way, if you're sick of our babbling, go to Bob and Brad
Oh,
Clips, our YouTube channel.
60 seconds?
60 seconds of us.
Yeah.
That's all you have to put up with.
We just talk really, really fast.
Yeah, yeah.
Just kidding.
Thanks for watching.